I think while it's not real, it's as close to real as you can get. And I think that's good as far as preparation goes. And also we can critique it here versus, you know, being in the real world where if you make a mistake, it could be, you know, detrimental.
We're taught certain things in our books, in lecture, we're taught certain things in our clinical, and then we have simulation. We come together, we bring it all. We may get thrown different things, and we may have to think on our feet, which is very good. It's a lot different than just having a book. It's a lot harder. I'll be one to tell you first because I know the book. And then when you end up having to bring it together, it is different. It's not the same. You know, you really have to, it's a different type of thing.
One of the most important things that I think is very valuable when it comes to simulation is the fact that you can actually test your skill and see what happens, and you can actually, and in your brain, you can think about what steps are you supposed to be doing and what steps you can do, and like especially when they throw in different kinds of scenarios at you. So it makes you more confident as a nursing student. It builds that confidence in you. It also gives you that opportunity to say, okay, now if I really, you know, mess this up, I can actually look at it again and see what I can change and see if I'm doing this right or what else can I augment doing steps here and there. So I think that's very valuable because it gives you that opportunity to, you know, use that to kind of meld in together the theory and the practice of nursing.
Yeah, I think the debriefing part of the simulation, that is that's very, very important. If not just as important as the actual hands-on part of the simulation, just because it actually goes through and it gives you the opportunity to relive that specific time that you did. And it's a way to summarize everything that you've learned, really. And it's a good thing not just for the student and the instructor that did that, but as well as the whole class, because the whole class could benefit from it just by listening to it and looking at the actual brief.
Simulation has been around since the 1950s, 1960s. It was first utilized by pilots and then by the military in mass training, mass casualty training. In the last 20 years, simulation has moved into the healthcare educational programs, first by anesthesia and now more into the other healthcare educational programs. In the last 5 years, it's really taken off in nursing education and other healthcare provider education.
I'm going to go ahead and give her 2 breaths.
Okay, I'm giving her 2 breaths. 1, 2.
Simulation is a bridge between book learning and actual patient care. Students are afraid that they're not going to respond appropriately in the heat of the moment, that that little bit of panic is going to paralyze them so that they can't do what they need to do when they need to do it. They're also afraid that they're going to hurt someone. And simulation provides us an avenue to give them the opportunity to have those experiences so that they have a plan. They have that little initial bubble of panic perhaps, but they know what to do and they respond as they should because they've had an opportunity to do it in this type of an environment where there is no opportunity for them to harm the patient. It doesn't have to be something as dramatic as they walk into the room and the patient's not breathing. It can be something as simple as they have a patient with a new diagnosis of pancreatic cancer and the patient says to them, "Am I going to die?" They don't know how to respond to that. They're afraid they're going to say the wrong thing, that they're not going to be supportive. We can do that through simulation so that they can improve their communication skills as well as their hands-on nursing skills.
Simulation is a 2-part process. The first thing we do is create the scenario based on what their learning needs are. Then we take, the student participates in the scenario at their learning level. Then we are recording the entire thing.
I look at the simulation as a tool, and along with the lectures and the textbooks and the the homeworks, it's a tool that the students utilize, and you can use that as a platform to develop your skills.
The second phase is the reflection or debriefing phase that we do. This allows the opportunity for students to view and critique themselves. It puts them in real time back in the situation so they can critically think and grow and reflect based on what they did or did not do in that actual simulation.
I think that is the most important part because it's constructive criticism and it's the best kind you can get. It's from your peers, it's from your teachers, and they're the ones that are helping us. We're a big team here, and I love it because you don't take it personal and you learn so much from it. And you even learn stuff from other people doing it when you're sitting around and watching other people and criticizing them. It's really helpful. I think it's the best thing.
From my point of view, I think it really helps give you an insight to things that you forgot to do, or maybe you were nervous because everybody else was watching, and maybe you made some mistakes, and it kind of helps you like bring it all together as far as what you're doing and what you didn't do.